So thank you so much for the invitation this morning and the bios. I won't talk too much about myself, but I am from the Human Sciences Research Council, and I am a social behavioral scientist that works for the Center of Community-Based Research. By way of overview this morning, I'll talk a little to the Human Sciences Research Council and its mandate regarding socio-economic development. I'll talk to the relevance of social science research more broadly, and then I'll talk to an area of my expertise, which is the work that we do at the Center for Community-Based Research. So you will see that this slide is a very busy slide, and that's because the HSRC has a very, very important mandate in relation to social science research undertaking in South Africa. It derives this mandate from the HSRC Act number 17 of 2008. And what this Act articulates for the HSRC is that we must initiate, undertake, and foster strategic, basic, and applied research in human sciences, address developmental challenges in South Africa, Africa, and globally, inform the effective formulation and also the monitoring of policy, and evaluate the implementation of policy. And a lot of what I'll talk to you today is at this nexus. Our task is also to stimulate public debate through effective dissemination of results. And I think that a lot of the work in research spaces tends to focus on the publication of the results and less on the downstream of feeding back those results to communities, whereas that is a critical component for us. The next speaker from the HSRC will talk to this important mandate of building research capacity in the human sciences. That is something important that we do, fostering research collaboration. The work I do a lot on is responding, as you mentioned earlier, is responding to the needs of vulnerable and marginalized groups in order to improve their quality of life. And then for the HSRC, one of the cornerstones is to have this data become accessible to the public. And I'll recall many years ago when I was doing my master's, a lot of my colleagues had used this for secondary data analysis. And Ben Roberts, in one of our other units, always talks about the use they get from their nationally representative survey called SASAS. The HSRC is often, the tagline for us is social science that makes a difference. And why that is because we focus on social science and humanities research. And that research is closely aligned with National Development Plan, Agenda 2063, and also the SDGs. And this talks to the need to fight poverty, inequality, and unemployment, which aligns well to our research aims that want to inform policies and programs that do these three things. Aligned to that, as I mentioned earlier, we have a strong focus on downstream or more upstream, if you prefer to call it, of making sure that that research that we develop into reports and publications is critically taken up for both policy and for wider impact. So why the social science? We often, we sit as a social science council alongside councils focused on health predominantly, innovation, science and technology. And where do we fit into this broad picture? I just wanted to unpack some terminologies that we use in social science before going into this. And if you are like me, and I know in the introduction it was mentioned that we are in in difficult times as a country, difficult times as the world, we don't exist in isolation. So for me, I made sure not to check any Instagram post this morning because the mindset that it gets me in makes it really difficult to function sometimes, with all the conflict that is going on. And we all operate in this kind of compound, complex system of influence where we influence and the systems influence us. So the social science is the study of individuals within these contexts and also of communities and societies, how people behave, interact, and within these broader complex systems. Because humans and societies and systems are complex, we need multidisciplinary lenses when we do social science work. And if you come into any corridor at any office in the HSRC, you'll find psychologists like myself, geographers, sociologists, data statisticians, medical doctors, nurses, and this is because the social science demands a multidisciplinary analysis. Likewise, with socio-economic development, that aims to promote sustainable growth, reduce inequalities, and improve quality of life. We need to unpack all these complex processes, behaviors, to ensure an enabling environment for economic development and planning. So why is it relevant to South Africa? As South Africans, we are very familiar with a paradox of life. And I've put this picture of Alexandra Township and Sandton in Johannesburg to highlight that. We live in high levels of poverty and inequality and unemployment. And then on the other hand, we have this Bill of Rights that foregrounds an expanded access to socio-economic rights. So we are always trying to balance these with what we do. Social science and humanities research wants to explore and underline the what, the how, the who, and the when. And the way we do that, is through understanding why things are the way they are. So a particular crisis in the country, like when COVID happened, and understanding the historical implications of apartheid policies, and as we move forward, how things have evolved despite all these great progressive laws we have, why things aren't always implemented as they are. So the critical role for social science is in identifying some of the issues, identifying enablers, not just barriers, and in understanding how to improve policies and also where policies are not working at all. So the social sciences are essential for understanding, guiding, and also driving social economic development in our country. So from what I've mentioned before, not only is our human resources diverse in their lenses and in their backgrounds, but within the HSRC, we have multiple units, centers, and divisions, each foregrounding different aspects of social science, but with the underlying aims to address those three barriers of poverty, inequality, and unemployment. IESA is a critical partner in ensuring stakeholder collaboration in South Africa and beyond. So Africa is a key partner there. You would probably be very familiar with the work of SESTI, who does a lot of our innovation innovation surveys, and they do a national one yearly. We have a department that looks at developmental, capable, and ethical state, and they do the South African Social Attitude Survey. The division in which I belong is Public Health Societies and Belonging, and we do the HIV prevalence survey started 20 years ago in this country that provided the first data on HIV and the extent and prevalence of HIV in South Africa. And we have a division that looks at education and the economies, and a vast array of national surveys that look at our literacy rate, for example, unemployment, etc. I could not begin to do justice on any of these units. I'm in a small center based at the Public Health Societies and Belonging, and so I want that to be the focus of what I talk to you about today. But before we move on to the work of the center, I think critical to the HSRC is that we don't just want to do research for an academic or knowledge generation activity. Our research, our social science research, aims to inform policy, and we make these inputs into policy developments to ensure that they are informed, proactive, and targeted, particularly, for example, in times of COVID. We did lots of COVID work and had lots of government engagements about things like the COVID-19 grant. We also want to make sure that the policies that we make recommendations that we analyze are evidence informed, and that they use the resources that are allocated to them effectively in order to benefit the most vulnerable populations and maintain public trust. Research is a fundamental component of this in terms of informing policy-making processes, as well as evaluating and monitoring the implementation of policies. So we do lots of policy analysis as social scientists, but also look at the extent to which policies are being implemented, and the gaps and areas for strengthening policy implementation. So this is the space in which I work. It is a rural, semi-rural community in KwaZulu-Natal called Sweetwaters. Our unit has been based here for the past 19 years. We'll go on 20 next year. And our aim is to develop our vision. Our long-term vision is for a community-informed research that focuses on health and well-being and access to the uptake of health and social services. So we want to improve community health and well-being, and also improve access to services. And how then does this focus on health impact socio-economic development? I'll talk to that more specifically as we go. But just so you understand the way we work, we have a focused community model that is built on the 4 principles of range, recognize, recruit, retain, and sustain. And, just like the importance of community participation entrenched in our constitution, community engagement is a fundamental component of what we do. Our research agenda, as far as possible, includes the participation of the community. So the issues of inequality, unemployment, and poverty are, you just look back at this picture and you can see, you could imagine some of the issues that this community faces. But driven by these, we prioritize concerns set by the community, but also involve them in how best to conduct the research as we go on. One of the key ways for community engagement is to make use of methodologies that are innovative. Now, at the center and throughout the HSRC, we use social science methodologies, and you'll be familiar with the large-scale surveys that I talked about, like SASAS and SABSM and others. But our focus at the center has been really on mixed methods, multidisciplinary socio-behavioral research, a strong focus on qualitative research as formative data that tells us about the context and what's contextually relevant to people. And I can tell you that, for example, during COVID, we learned that people were not willing to vaccinate because this would take them away from their homes. They had to be in long queues without having food. And if they had to stand for 8 hours, they would rather go look for a piece job to be able to get access to some kind of resources and support. And so in this way, a lot of this formative, engaging research helps us to identify how to intervene. Another such example, with some of our COVID vaccine hesitancy work, we use a method called expression sessions, and it's very flexible, very participatory. Participants are just asked to come with something that explains what it is, what their life experience is like at the moment. And during lockdown, we had people bringing up their wallet, which was completely empty, a financial statement from their business, which had to close down. And we were able to then engage further qualitatively about what this meant for their lives. And other participants could also talk about the impact that the pandemic had had on their lives. So I just want to show on the right, when you are in certain contexts, you have to make sure that your research is contextually informed. And initially, we went into this community with really sophisticated GIS maps to help us identify the route to and from school. And no one could relate to those maps. And people wanted to show us on their own through drawing what their life experience or their journeyed experience of navigating school journeys were. And so just making sure that your methodologies are always informed by the community and your research question, but also just our increasing use of participatory methods is because they minimize power imbalances and put the participant at the forefront of their knowledge. They are able to engage in a way that's more comfortable for them, and also enables what we found to be deeper reflection on the data. I want to quickly just go through some key thematic areas that will link back to socio-economic development in the work we are doing that focuses on decentralizing health services, improving adolescent health and well-being, and driving community programs. A lot of what we do at the center for many years, as HIV has evolved, and it was extremely stigmatized at one point, to the point now where we are worried more about the other end of the cascade of getting people linked to care, staying on care, and virally suppressed. We have focused on taking HIV and TB care to people in communities and out of brick and mortar facilities because of access in particular communities where service delivery is low, access to electricity is low, access to money is low. So there's high unemployment, high poverty, people don't have money to go to clinics. We've developed ways to take these healthcare services to them, both for HIV testing, TB, and HIV prevention. And the impacts of this have been manifold. We've been able to demonstrate that HIV testing strategies are acceptable, and we've been able to innovate in terms of HIV testing modalities. One of our studies called DOART, or the Delivery Optimization of Antiretrovirals, is now being implemented by the Health Systems Trust, which is a district-wide implementation. And this is extremely significant because I mentioned earlier that we want to do research that makes an impact. And often we will evaluate and test interventions that we hope government takes up one day. And this is why that is so significant. Another study was able to find, and counterintuitively almost, that people are willing to pay, even in the context of Sweetwaters, for access to medication. So they'd pay a nominal fee for delivery if this means they avoid having to go to the clinic, the transport costs, the waiting times, and the inconvenience, which is a significant finding for us. And the work we've done have led to the opening of a couple Unjani clinics in our community, and this is where retired nurses come to open clinics and offer almost a privatized service for, or a paid for service to our community, where they pay an amount, I think it's 250 or about 300 Rand, to see these nurses and access an array of healthcare services. So it's bringing in an income for the nurses, and they've been expanding over time. So there are a couple, almost 100, I think, in South Africa, but about 3 in Sweetwaters, and they have now expanded to offer mental health services. But ultimately, doing this decentralized health service has done has improved access and uptake to healthcare, and we all know how much healthcare takes out of our GDP. So it's an important contribution there.
Dr. Essack, you have 4 minutes to complete.
I'm almost done. Our second area is in improving health and well-being. We've done some participatory methods to engage young people, and unemployment has been high on their agenda, but also sexual violence. And through this early formative research, we got funding to develop a walking school bus intervention where children are chaperoned to and from school every day, and we found that it's not completely effective, but it helps manage some school-related gender-based violence. And because we are in a context where there is limited funding to provide actual transport to and from school, this is a cost-effective solution to protect children. And then finally, I spoke about the importance of having research with communities. We do not always get, because we have our agenda that's focused on those 3 important issues for the HSRC and for ourselves. We have worked somewhat aligned with the community to develop certain projects, including career days, vegetables, growing of vegetables, the walking school bus. We took the data from that study and are now implementing it in the community. And in this ways, young people have been able to start their own businesses, and vertical tower gardens have been implemented. People exchange this with each other. Some people are selling their vegetables to others. And, importantly, we recruit staff where feasible from our community. So for all our projects, we have 180 staff, and many of them are recruited from our own community. So there's an important focus there on youth-linked jobs and employment and capacity building. So the 3 take-homes I want to highlight is that social sciences are essential for understanding, guiding, and driving socio-economic development, that we must take a holistic, multidisciplinary approach, which is required to address all the pressing challenges in our country, and that to do this, we need social science because it's fundamental to relevant, responsive interventions and for evaluating how well these are implemented. Thank you very much for your time.